Recording in progress.
From many distant lands, our forefathers came. From many distant lands, our forefathers came. Some seeking adventure, some bound in chains. Through battles waged and fought, through victory and pain, by test of their courage, our freedom was gained. In homage to those gone before us, the heroes of lands in the sun, we vow to join hands and to focus on building one Caribbean. Raise your voices high and sing of your Caribbean pride. Sing it loud and strong. Feel our hearts beat as one. Celebrate in song as we rise to heights where we belong. Sound the victory drum for CARICOM. Though great and diverse be our ethnicities, the bonds that unite us are stronger than these. We dine, we pray, we love, we dance and we play. We relate to each other the West Indian way. Today as a people united, determined and steadfast we stand. We look to a brand new horizon, the future now firmly in our hands. Raise your voices high and sing of your Caribbean pride. Sing it loud and strong. Feel our hearts beat as one. Celebrate in song as we rise to heights where we belong. Sound
Welcome, everyone, and thank you for joining us for this virtual event in observance of Caribbean Wellness Week 2024 under the theme Good Health is Our Right, brought to you by the Caribbean Community, CARICOM, and the Caribbean Public Health Agency, CARFA. My name is Dr. Tiffany Skerritt Fleming. I'm a medical doctor practicing in Montserrat with the Ministry of Health and Social Services, and I am currently serving as female CARICOM Youth Ambassador for the island of Montserrat. I am pleased to be your moderator for today's webinar. A warm welcome to those of you who are joining us via the World Wide Web, YouTube, Twitter, and Facebook as well. Let me warmly welcome you on behalf of the CARICOM Secretariat and the CARFA. This webinar is designed to improve your knowledge of MPox, including how it spreads, updates on global outbreaks, and risks to the CARICOM member states. Our facilitator will also highlight how to manage chronic conditions during outbreaks and provide illustrations using case studies on the impact of outbreaks on individuals with chronic illnesses. We will also discuss practical advice for individuals with chronic conditions on staying healthy and safe during outbreaks. Our facilitator will also share resources available for support and information. He will lead us in a discussion on how infectious outbreaks affect mental well-being and guidance on how to maintain our mental health. Lastly, there will be a question and answer segment where you can share your concerns about MPox with our expert. Before we start, a few housekeeping points to note. Firstly, your microphones will be muted, so if you have any questions as the presentation progresses, feel free to leave them in the chat. As I mentioned, following the presentation, there will be a Q&A segment. We invite you to raise your hand using the icon, and we will unmute your mics alternatively. If you feel uncomfortable with unmuting and sharing, you can leave your questions in the chat, and we will review them. Finally, this webinar will be recorded and shared on the CARICOM website, YouTube channel, and social media platforms for the benefit of all member states. So let's break some ice. I invite those of you listening and participating to drop your names and your member states in the chat. Turns out you might have some friends here. And in addition to that, you can look out for the link to our pre-test. It's a very short test, just 4 questions, and it will give us an idea of how we can improve our content as we go forward in this webinar. So I'll give you a minute or two to do the pre-test, and then we will resume right after. So checking in with our participants, if you are now joining us, welcome to this MPox webinar being hosted by the CARICOM Secretariat and CARFA. You can see the link to our pre-test in the chat. So I can see from our chat, we have persons from all across CARICOM. I see present here representatives from Guyana, Turks and Caicos. We have a check-in from the Secretariat. We have Virgin Islands as well. Welcome to all those who are joining us via various means, whether Zoom or otherwise. I know you'd have just been wrapping up your pre-test, and so we're going to be moving right along. Thank you for completing our brief quiz. And I now invite you to join our presenter to discuss MPox and managing chronic conditions during outbreaks. Ladies and gentlemen, please allow me to introduce Dr. Horace Cox, our facilitator for today's webinar. Dr. Cox is the Acting Director of Surveillance, Disease Prevention and Control at the Caribbean Public Health Agency, CARICOM. He has over 12 years of national, regional, and international public health experience. And his interests are networking closely with medical, public health, academic, and other key stakeholders to advance the health and well-being of the Caribbean people. Dr. Cox, welcome to today's webinar.
Thank you very much, Madam Moderator, and I must commend you on making it very lively at the start. You've eased the pressure on me. I really appreciated the icebreaker, and perhaps I can start by saying that it's a pleasure to be here with members from the CARICOM Secretariat as well as the region on a whole. And I noted when you were going through the attendee list, and I know more persons will join. So I think it's a real pleasure. And today we have the opportunity to share something that is of significant public health importance. And I'm quite thankful to have the opportunity to share on behalf of the Caribbean Public Health Agency. So with your permission, I'll just share my screen quickly, and I will put this into slideshow. And yes, I will make a start. So as was correctly said, today we're going to be speaking a bit about what you need to know about MPox. And there really is a lot that you need to know. But of course, we try to share it in bite sizes. And I believe that this is a step in the right direction, and that we will follow up with other webinars similar to this one, so that we keep you engaged on this very relevant public health topic. And so today, I'd just like to start by establishing some context. Given that we do have a very varied audience, we have very technical people as well as some persons who have who part of general public, if I may use that term. And as a result, I'll try to see how I can present it in a way that it benefits all. So what we'd like to first state is that it's not the first time that we're hearing of MPox as a public health emergency of international concern. And I will share a bit with you in a few seconds as to what it means when we refer to a disease being a public health emergency of international concern. And just that we just established context, MPox was first declared a public health emergency of international concern in July 2023, and that lasted until May 2023. And I know some of you, your memory might have been jarred a bit, because that was exactly about the time when we were coming out of the emergency phase of COVID-19, and we were thinking that, well, look, we're going to integrate the whole COVID-19 response into the routine public health work that we do. And we really were starting to believe that we were going to resume normalcy in life. And then there we had it. We started to see cases spike of MPox. And as a result, the declaration was made. But this only lasted a year. And then the declaration was terminated in terms of it being a public health emergency of international concern. And again, we thought that we had come to the end of it, and we started to breathe a sigh of relief. And then in August of this year, as we were addressing other public health things, we understood that the Africa CDC had declared a public health emergency of continental security on August 13th. And because of the spike in MPox cases that they were seeing in the Democratic Republic of Congo, which had been spread into many African countries that were in close proximity, there was a meeting convened at the level of the World Health Organization. And after some contemplation, the determination was made that MPox needed to be declared a public health emergency of international concern for a second time. And this declaration came in August, exactly on August 14th, 2024. And since then, we've been seeing continued spread to countries in Africa that never had MPox before. And again, the main issue being in the Democratic Republic of Congo. And it has been identified that in this instance, the main issue has been with clade 1B. Before, we were hearing of clade 1A and clade 2. but it was clade 1b that was causing the increased transmission noted in Africa and the spread to the surrounding countries that were in close proximity to the Democratic Republic of Congo. So as I've established, when we're thinking that it may be unfortunate to have the first declaration of a public health emergency of international concern, we will hit a second time and we're still in the public health emergency phase. And since then, we've seen spread outside of Africa. We had cases that were notified in Sweden. We had cases that were notified in Thailand, and there is literature to support. But of course, on this first slide, we've started to use a term, and some persons might be asking the question, what is a public health emergency of international concern? It might just be triggering a memory a bit, and you might be saying, but I've heard this term before. We were dealing with COVID-19. I heard this term before when we were dealing with Zika, but I really don't have a grasp of this concept. And so I wanted to leave with you this definition, and it's a definition that is taken straight out of the International Health Regulations 2005. And it says that a public health emergency of international concern is an extraordinary event. So it's more than you could have imagined, right? Which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. So if we take this very lengthy definition and we sort of break it up, and we use our understanding from the previous slide as to what was happening with clade 1b, it started in the Democratic Republic of Congo, and then it started to spread to countries that were neighboring and to some countries that didn't have MPox before within Africa. And then it started to spread. They started to pick up cases outside of Africa. So there we see, this is an extraordinary event. You started to see children affected a bit more. You started to see faster transmission. You started to see indications of a more severe disease. And because of that, it was determined to constitute a public health emergency of international concern. And because of the frequency of international travel, the threat of spread was estimated to be significant, and therefore informed that declaration being made. So perhaps what I want to leave with you, apart from the definition here, is that the whole essence behind making such a declaration is to say to everyone, what we need is for all of us to come together on an international scale to be able to have a coordinated response. So that's the trigger that happens when you have the declaration of a public health emergency of international concern, that it really triggers a coordinated international response that can facilitate rapid mobilization of resources, so funding. And so, for example, when there was a declaration for COVID-19 and even Zika, etc., it can really expedite access to funding and also expedite the advancement in research that will lead to development of vaccines, therapeutics, and diagnostics for emergency use. So I know that I've been saying quite a bit in the first two slides, and so I wanted to leave with you this depiction here that perhaps will make it simple. So as we said, in 2022, just about the time when we were starting to say that COVID-19, we will integrate it into the more routine public health efforts, we saw the first outbreak of MPox in all 6 WHO regions, right? And in this case, it was clade 2b, right? Then in July of 2022, you had MPox. It was declared the public health emergency of international concern. Subsequently, in May of 2023, that declaration was terminated, and then you had standing recommendations as to how to address the continued transmission. So just to reiterate, for those who might not be very familiar with the topic, that not because the declaration of a public health emergency of international concern is terminated means that there isn't still an issue with transmission, right? It's just that it's scaled down the level of importance. However, there still need to be standing recommendations. And that's what we had in August of 2023. But then, of course, it started to pose a problem again in May of 2024, and it culminated with the declaration of a public health emergency of international concern for the second time in August of 2024. And mainly in this instance, for the reason of the transmission of this one, which is clade 1B. So as you're aware, and I just wanted to sensitize you that we're no longer using that term, and I'll just say it for the purposes that you know, of saying monkeypox. The correct terminology is MPox, and we would like that all persons who are tuned in, they're using the right terminology and that they will fair with the adjustments that have been made. Importantly, looking at the different strains, yes, we've spoken about clade 1, clade 2, and all these. I won't go into the very specific because, again, we're speaking to a general audience and we have different levels of preparation. But you had former names of the Congo Basin and the West African, and these, of course, were replaced by clade 1 and clade 2. So I'll just leave this here for now so as to not complicate it too much. Just on a very high level to indicate that these depictions are as of the 31st of August 2024. The global MPox cases seen here on the left and deaths on the right. Basically, you can see the level of spread in terms of transmission of these cases, as well as the level of occurrence of deaths. And because of that, it is a very relevant issue. And because transmission is more significant with clade 1B, that originated in the Democratic, well, I shouldn't say that the bigger issue started in the Democratic Republic of Congo, which spread to the neighboring countries and then started to spread outside of the continent of Africa. Because of that, it really triggered that call for a coordinated international response. So this slide it just has some figures. I won't really take you through the figures, but it'll be here for reference for those that may want to look back at the figures. And of course, you will see at the bottom of the slides the source of the information. So for those who might be a bit more interested in getting some more details, you can take a review. So this is what transmission look like. When we, for example, when we go back to July of 2022, and we assess, here you see lots of cases being reported, and then it tapered fairly quickly going into January 2023 and onwards. And then, of course, we saw this spike, which led to the declaration. In terms of distribution, I know many persons may be asking the question, so what is happening in the Caribbean region? And here we present some data that was taken from the US CDC in terms of distribution across some countries, and we sort of filter that to present in a way that you would be able to relate. And here we see from not only the Spanish-speaking Caribbean, but also you see cases from the English Caribbean as well as French-speaking. All right. So of course, this here not only refers to it refers to different clades, I should say, of MPox, and therefore you shouldn't run away thinking that this is referring to what recently would have triggered the declaration of a public health emergency of international concern in August. So we've heard about the different clades. We've heard about the 2 declarations of a public health emergency of international concern. But importantly, I'm going to attempt now to take a deeper dive into some information on clade 1B. So some persons may be asking the question, yes, I'm aware that the public health emergency of international concern has triggered this international call for coordinated response because the risk is significant. But some persons may say, tell me a bit more about clade 1B. And so clade 1B was detected in the eastern part of the Democratic Republic of Congo, and it was the first case of it, so to speak, and it was through human-to-human transmission. Now, importantly, it is transmitted more easily, and there's been note of perhaps it causing more severe cases and also affecting children a bit more than the other clades. So that's why you want to pay particular interest to it. And so persons may be thinking, oh, well, I'm in the Caribbean region. I have plans for the next months. Yes, I've been following what's happening with MPox, but what does this mean for me living in the Caribbean? And so what we want to draw your attention to would be the level of risk, all right? And the level of risk for the Caribbean has been estimated to be low to moderate at this time because of the declaration of the public health emergency of international concern because of the frequency of travel to and from the region related to places where you've had cases detected before, etc. All right, so that risk level has been assessed as low to moderate, and that's reflected in the documents that CARICOM would have issued relating MPox. So this is a bit about the case profile. So what we've seen in the last 6 months, more or less, is that of all cases with available information, about 99% of MPox cases were males. So definitely in terms of messaging and engagement, and shortly when we transition to a few other slides and we look at the mental health impact of these things, we'd be able to understand how we can tailor our message to suit the target audience. And 99% of MPox cases would be, over the last 6 months would have been seen in males. And of course, we've seen also consistent with what was reported before when you had high numbers of MPox cases at the time when you had the first declaration of a public health emergency of international concern. 96% of the cases over the last 6 months would have been seen in men who have sex with men. And of transmission, you see by sexual encounter being the most common, and that's consistent with what would have been shared in literature prior. So I won't burden you with these next slides. I left them in because, again, the webinar will be available online. And again, we are targeting a wide range of professionals and personnel. So you may have someone who's a clinician who may be asking the question of, okay, so I understand all the public health context, but tell me, when I'm sitting in my office and I see a patient appear with a lesion or a rash, so to speak, and it looks suspicious, how do I know when to determine if it's a suspected case, et cetera, et cetera. And it's about empowering you to be able to have a high index of suspicion so that you'll be able to identify those cases at the earliest opportunity and to be able to channel them to the right access of healthcare at the right level. So I will just transition through the slides because, again, this is not something that's focused on clinical management, so to speak, but we just wanted persons to be from a broad surveillance perspective to be oriented as to what contributes to there being a suspected case, as well as what may be a probable case or a confirmed case. And this might be for the persons who are a bit more technical, as well as a reinfected case. So again, the intention is not to go through all the text that's here, but noting that it's recorded and that it will be shared online, persons can have the opportunity who may so be interested to pause and to access the information as it is presented here. So at this time, I'd like to just speak a little bit about MPox surveillance. So for those who may not be familiar, understanding, again, it's a broad target audience. Surveillance is basically, I might oversimplify it in saying this, but it's basically the continuous process of looking to see what's happening. And for that, you need to collect information and analyze it and do all the other things to ensure that you can understand what is happening. All right, so for persons who are working with syndromic data, etc., we encourage that that there's enhancement of syndromic surveillance systems and that case investigation for the rapid identification of cases presenting with rash and fever. Also, it's important that there's elevated awareness among clinicians who will be attending to persons who could be suspected MPox cases, that those clinicians are sensitized adequately, that they can be able to have a high index of suspicion and be able to make a clinical diagnosis, and that can then thereafter be confirmed with some lab support. Infection prevention and control procedures, those are very important. And I think that after COVID-19 experience, I think everyone has an appreciation of infection prevention and control and how this can contribute to making us healthier and safer in the environment in which we live. And of course, to be very wary of persons who are traveling from places that have had cases of clade 1B. Noting that you have MPox cases in many countries in the world, But the public health emergency of international concern, which has been driven mainly by the transmission of clade 1B, we'd want to be very wary of persons that are coming from places where you have outbreaks and ongoing transmission. So we've said all of this, but then again, it doesn't have meaning unless we can engage persons at the community level. So when we speak of messaging, we have a few, and forgive, these are outdated messages, but I wanted to illustrate the point as I warned persons at the start. We're no longer saying the term that you see here, referring to it as MPox. So I left this here to say that we need to ensure that when we're conveying the message that we don't slip and make the error of having this expression here that we refer to it as MPox incorrectly in the message. And this decision was taken to ensure that we reduce the level of stigma and subsequent discrimination that's associated in using that terminology as before. But of course, the sensitization should be tied to persons understanding what some of the common signs, for example, unusual rashes or lesions on the genitals or other parts of the body. Remember what we spoke about in terms of certain groups being particularly vulnerable or at higher risk based on the data that we're seeing. Over the last 6 months, 99% of the cases that we would have looked at would have been among males, and 96% would have been among men that have sex with men. So also there is the transmission that can happen from wild animals in areas where MPox regularly occurs. Is not just the human-to-human transmission. And of course, it can be contracted by coming into contact with contaminated materials. So at this point, I trust that you're very much with me as to why MPox was declared or has been declared a public health emergency of international concern for a second time. I trust that you're with me that concerning the fact that clade 1B, which caused significant numbers of cases in Democratic Republic of Congo, with further transmission to neighboring countries in Africa, and then transmission beyond the continent Africa, would have been the main trigger. The increase in cases would have been the main trigger for the consideration of, or the contemplation of, the declaration of a public health emergency of international concern, which later materialized. I also trust that you understand at this time what are some of the things that you can hone in on a personal level, at the level of family, in terms of ensuring that you can adhere to practices that would encourage infection prevention and control. And going back to it, even though some of the non-pharmaceutical interventions tied to COVID-19 would have helped us to be safe, you need to understand that with MPox, for example, coming into contact with contaminated surfaces and materials, etc., can also be a means of transmission. So it's very important to ensure that we are practicing good infection prevention and control, whether it's in an ordinary setting, whether it's in a hospital setting, or whatever the case may be. So with that brief summary, I will attempt now to transition to the other component as the moderator eloquently would have proposed. And now we're going to speak about NCDs. And some persons might be hearing this for the first time. Well, I'm well aware that we have persons who are tuned in who are very familiar with these concepts. I've also seen that we have persons from who may be considered lay people for some of the more technical terms. So when we speak of NCDs, we're talking about non-communicable diseases, diseases that cannot be transmitted from one person to the next, all right? And to put it in simple terms. And we wanted to start by sharing, for example, that individuals with non-communicable diseases may be a bit more susceptible to MPox due to several factors, right? For example, and we'll come to some of those in a bit. You have non-communicable diseases like diabetes, cardiovascular diseases, cancer, that can have a debilitating effect on the immune system, which is the system that fights off infection naturally. right? So when it debilitates or weakens that system, it really predisposes you to getting other infections quite easily. So just to say that there is a link there, and if you have chronic diseases, so for example, those persons that know they have diabetes, this also underscores the point, and in alignment with the observation of Caribbean Wellness Week, we want to ensure that you are doing all that you've been advised to do by a physician, by a clinician, by the health service in terms of ensuring that your diabetes is under control. Because as you see these different diseases, you need to understand that if it is that you don't have the level of control that is required, then you can expose yourself to becoming infected with, be it MPox as it is now. Before we saw with COVID-19, this was a challenge where persons with diabetes and other chronic diseases, they were having perhaps more severe manifestations. So you really need to take those things seriously and to try your best to ensure that you take the opportunity to manage, if you have a non-communicable disease, to manage that well. And that, of course, extends to cancer as well. All right. Now, in terms of immune system compromise, as I said, if the immune system is debilitated, it affects the ability of the individual to respond to any infections that might be within the environment, so to speak. So now we're going to speak a bit about risk factors. Now, what are some of the risk factors for non-communicable diseases? So yes, we know diabetes can weaken the immune system, and because of the weakening, it can predispose you to becoming infected with MPox or perhaps having a more severe manifestation of it. So things like obesity, physical inactivity, and of course, now you know that depends a lot on the type of lifestyle that you lead. These are things that can be real risk factors in terms of kind of precipitating the manifestation of a non-communicable disease, so to speak. And perhaps I just wanted to reiterate was at the bottom that while the focus has been on specific populations affected by MPox, it is crucial to consider how underlying health conditions such as NCDs can exacerbate the risk of severe outcomes. And just to put it on the table so that we can all appreciate that even though we've had the declaration of a public health emergency of international concern, the reality remains that a lot of studies still need to be done to kind of understand in better detail the modes of transmission, why you have severe manifestations in some cases more than in others, et cetera, et cetera. And so there's a lot of investment going towards understanding this in better detail so that you can have better informed programs to address this as a public health issue. So you may have persons in the audience that might be saying, well, I don't have diabetes. Nobody in my family has diabetes. Yes, I might have heard of somebody having diabetes, but I really don't think this is a concern to me. And so what we wanted to share here is basically from the International Diabetes Federation. And this is a graph that looks at diabetes prevalence and global impact. And here you see the region of the Americas. This is by region. It's right up there. It's third, right? It's only outdone by Southeast Asia and Western Pacific. All right. So this is diabetes prevalence by region, and we are a subset of the region of the Americas. Yes, we've not given it to a granular level that we're speaking specifically about the Caribbean in this slide. But at the same time, as being a part of the region of the Americas, we need to appreciate that this is of concern to us. If you're not someone with a communicable disease that might debilitate the immune system and predispose you to having several infections or different infections, as in the case of MPox, etc., you still need to take the messaging so that you can encourage others that perhaps are part of the family as to how they can improve physical activity and also adopt lifestyle behaviors that will help them to have a strong immune system that they can fight off some of these infections. So I think I've more or less spoken quite at length about diabetes and immune dysfunction. For those that might be a bit more technical in the audience, just to say that the immune impairment, it comes from uncontrolled blood sugar levels, especially when the levels are very, very high. And I won't get into the pathophysiology of that. And of course, that leads to can lead to increased susceptibility. So going back to it, if you know persons that have poor glucose control, and sometimes you're chatting with them and they say, man, I tested my sugars, they might say loosely, and it's very high, but I don't feel any way. I'm not going to do anything about it. You take the opportunity to tell them, no, I was at the webinar. The webinar spoke about MPox, and this thing is real, right? And it might be something else tomorrow. At the time when it was COVID, persons that were diabetic, they had more severe manifestations, and in some instances. So you need to take the opportunity to share the message and to use the knowledge that you have to help others as well. All right. So we included a slide on anti-diabetic treatment, but I don't think we need to be as specific as that in terms of the deliberations, but it's included here so that for those who may have an interest, they can access the recording and go to it after. So yes, we've spoken about MPox. Yes, we've spoken about NCDs. We've spoken at length about diabetes and how this can affect the immune system and how it can predispose us to getting infections much easier. So we want to transition and take a look at something that's very, very pertinent, which is mental health. And at times, because of the stigma associated with this, we often feel as if we just can't share our concerns about mental health if we're affected by it, etc. And this came to light in the COVID-19 pandemic, and you had several studies that documented the effects of or the manifestations of mental health issues in the population secondary to the COVID-19 pandemic, and that were precipitated or exacerbated by the COVID-19 pandemic and some of the measures that were taken. So to be honest, this is a real problem. And we need to get to the stage where, as part of the whole alignment with the Caribbean Wellness Week, we need to get to the stage where we feel comfortable speaking about it as an issue. And we understand how public health challenges like MPox and COVID-19 can have a negative effect on one's mental health. All right. Perhaps just to say that as we know, quarantine, you have some persons who are very social. They like to engage. They like to be out. They don't like to be trapped in a space. So just put yourself in the place of someone who is being diagnosed with MPox, or someone who was diagnosed with COVID-19 before, had to be in isolation, etc. And the fact that for prolonged isolation, this can lead to depression, right? Anxiety, right? Post-traumatic stress symptoms. And these are things that are documented through different studies and quite common, right? So even though there are certain prescriptions to kind of minimize the transmission of a disease, etc., the reality is that we still need to consider how that affects the human being, because the human is also part of the environment and is very social. All right. So it's time that we examine MPox and mental health, right? And remember, we're looking at the relevance of this for Caribbean Wellness Week. And so mental health challenges emerging during and after infectious disease outbreaks, those are well documented, as well as the importance of addressing mental health in the context of MPox for holistic care. That's very, very important. So we wanted to more or less leave with you a few important messages. One is that mental health challenges can result during MPox outbreaks, right? So while it might be a case now where the Caribbean might not be necessarily a hotspot, to use that term for MPox, we need to be very familiar with how this can affect our mental health. God forbid, but should this become a bigger issue? And one is that the social isolation due to quarantine, or even the stigma, right? I recall persons saying when persons who would have had a similar disease, persons who would have had chickenpox, and the stigma associated, they don't want, others don't want to come close by. They're so fearful. When they look at what's visible and they see the lesions, they're like, oh no, I'm not going close. And that takes a toll on the person that's affected. There can be anxiety and fear related to the infection. The appearance changes. Persons who used to endear you, embrace you, they no longer do it in the same way. And, there can even be trauma from hospitalization or the worsening of pre-existing mental conditions. They can really precipitate and cause a lot of problems. So we really need to be cognizant of how these diseases, especially when they're full-blown and they require social isolation, how they can be particularly problematic and can lead to trauma. And therefore, we need to really treat the person as a whole. And so, yeah, I spoke about the MPox-associated lesions, the visible lesions, and we know what we see, we react to it as people, right? It's only natural. There are misconceptions about the transmission and affected communities. The best way is to empower yourself by accessing information from credible sources. You have a lot of misconceptions, you have a lot of myths, and those things inform the incorrect behaviors. You want to ensure that you do what's right for you and for your family, and also be the best health promoter that you can be so that you protect you and those that are around you. So going back to fear and anxiety, yes, when we spoke earlier, we understand that there could be depression and what have you, but there's the fear of contracting this virus, right? Just imagine if somebody were to be absolutely okay today and tomorrow they wake up and they see that, oh no, where did this rash come from? I didn't know that I had this before. I just attended this webinar. Could it be that I have MPox, right? Could it be this? Could it be that? So that of itself is some level of torture and leads to fear, it leads to anxiety. And so the best way is to empower yourself through having access to the right knowledge and also to access health services, right? So you can manage the psychological stress, right? Also importantly, I believe I noted a few from the media, right? It's important that in the reporting, whenever we report in, we need to convey the facts. The population needs to be empowered with the reality. However, we need to be responsible with how we report so that we don't contribute to psychological stress and also further any misconceptions that there might be. All right, and so going back to quarantine and isolation, the reality is that, or even hospitalization, is that these things can cause psychological trauma, and we need to really treat the person as a whole. We need to understand that it's not just about administering the medicine, or it's not just about having the person in a hospital or having the person at home, but that we need to identify with the needs of the person and try to find ways within the right guidelines to ensure that we don't contribute to the trauma. Because again, we don't want to create a problem that will last for a long time afterwards, or we don't want to create what we call unintended harm, and as such can really affect persons. We spoke about the physical symptoms and their psychological impact. There are persons that find it difficult to come to grips with the fact that you have the rash, you have these different lesions. Persons start to wonder, is it because you're in XYZ at-risk groups, etc. So we need to ensure that we manage those, the engagement that we have, and that we be responsible with the way we engage with persons. So yes, it's important for us to look at the disproportionate impact on vulnerable communities. For example, if there are health disparities in access to care for vulnerable groups, if you have disparities in access to mental health services, these are things that are very important. So the reality is that we must come to the point, if it isn't happening already, where we integrate mental health into the MPox response. And so as part of this webinar, we want to say that it's important to not only think of MPox in terms of, okay, what could we do to definitively treat this disease, but we want to address this from a holistic public health perspective. We want to identify those at-risk groups, right? For example, for persons who might be working in a clinic setting, when you're attending to your patients in the clinic and they have a chronic disease, and you understand that because the control is not being good, you know, they might be predisposed to risk of certain infections. You want to have the counseling session with them where you can share the information. For persons who might be in certain at-risk groups, you want to empower them with the information and with the knowledge that you may have. And also, in terms of integrating the mental health aspect, you need to be very vigilant as to, is it a case where persons might be very fearful? What's feeding the fear? Could I guide them in the right direction to get information? Is it that they're misconceptions, right? So we need to address this in a very proactive manner. So the reality is, and the underlying message is that apart from the physical effect of having a disease like MPox, it's important that we understand the mental health challenges, all right? And so to mitigate these, there are several things that could be done. For example, psychoeducation, raising awareness about the disease to reduce stigma and fear. We can ensure that there is access to mental health services and that we reduce any disparities that might exist, that there's community support, so there could be sensitization that's happening at the community level, that there's stigma reduction in terms of campaigns to let people know that, look, anybody can get MPox. We spoke about the way in which it's transmitted. You can have a healthcare provider in a hospital who does not necessarily observe all the infection prevention and control measures and can become infected with MPox. So the reality is that we should be responsible in terms of how we convey that message and how we perceive things once we understand that someone may have, right? So in conclusion, when we're addressing a person, it's important that when we're looking to combat MPox in alignment with the theme of this webinar, that we look at the physical, we look at the mental, and importantly, which is not in the slide, but we look at the social component for the individual, because all these things come together. And for us to reduce stigma and promote holistic care, we need to have a call to action, which is to prioritize mental health in response strategies. And there's no better opportunity than to use it now, while MPox is also, for the second time, a public health emergency of international concern. So we have some references, and I will just leave it on this slide so that you can, as you access the recording afterwards, you can have the references to, and there are lots more that you can access. Okay, thank you very much for your attention. I trust that by now you're very familiar with the concept of what's a public health emergency of international concern. It's a declaration that is triggered by a rapid increase in cases, so to speak, to put it in a crude way, that warrants a coordinated international response because of the threat that it poses, right? And as we said before, MPox is the second time there's been declared a public health emergency of international concern. And we understand that it affects men a lot more than women, and there are certain at-risk groups among men. Having said that, it's important that we remain vigilant because there is so much travel. So you might not have MPox in your setting today, understanding that this webinar may be very far-reaching and it's not only persons in the Caribbean that we might be speaking to, but the reality is that you can never tell because there's travel every day and persons are at risk. And we spoke about some of the chronic diseases that can really weaken the immune system and kind of make persons a bit more predisposed to becoming infected with MPox or any other infection. And of course, if the immune system is weakened, you can have more severe manifestations of the disease. So the message there is that we ensure that we reinforce the concept of persons with non-communicable diseases. In order to be well, in order to be healthy, you need to ensure that you maximize the efforts to maintain control. So when you hear persons speaking well, loosely that, oh, my sugar was high, I didn't take my tablet, I didn't do this, I didn't take the insulin, whatever the case may be, you need to encourage them and you need to correct that. Of course, we want to identify and understand that diseases, infectious diseases, they have an impact on mental health. And the reality is that it's not just the biological part, nor is it the mental part, but it's the social part. And sometimes in trying to contain a disease and have certain measures, you can trigger the other side of it. So if you have someone in isolation as much as it is recommended, or in quarantine, depending on the individual, it can have an effect. So we need to, again, honing it back on the underlying message, we need to ensure that we treat the individual as a whole. And let's remember that as we engage others, we need to be responsible. And remember, the thirst for knowledge is the best way for you to ensure that you're best equipped to address any challenges and to inform your actions well. I trust that this has stimulated your interest and that you will continue to seek more information on MPox, especially considering that it is still a public health emergency of international concern. Thank you.
Thank you so much, Dr. Cox. Lots of useful information, lots to digest. We appreciate the recap. For those of you who have been joining us and tuned in, we're looking at MPox. We've had an expert here to kind of break it down and help us understand what we should be looking out for. We do have a few questions, so I'm going to pull those up now, Dr. Cox. The first of which is, should I be wearing a mask now when I go out into the public? So persons are wondering. And the other one is, what are some websites that persons can use to get updates about MPox?
Excellent. So regarding the question about masks, we were speaking earlier about infection prevention and control measures. And I referred to some of the things that were done during COVID-19. And I'm very pleased to see at times when I walk in the streets that persons have the mask and they use it. Sometimes even on the plane, people still use it. And I'm encouraged because even though there isn't necessarily that push from a public health perspective or an insistence that persons use the mask, generally speaking, there still is the identification on an individual level of the importance and how it protects. So I just wanted to start by saying that once one feels the need to use a mask, please do. You can only benefit from the use of a mask. Now, going specifically to the question, there has been, from some of the studies done, the identification of a respiratory component to the transmission of MPox. And so because of that as well, depending on where you are and how you're interacting with people, and depending on the level of risk, there may be a need for one to use a mask, depending. But as I said, I think there is no harm in using it. And of course, you can inform your thoughts by reading a bit more and understanding the level of risk. It depends on if you're a healthcare worker, where you're working, with whom you're dealing, and all those different things, right? I wouldn't understand it's a very general audience. I won't go too specific, but just to note that, yes, there are indications for the use of masks, and not only in this case, but also beyond that. On the second point of where to access information, I'm very happy to have that question. So the first thing I would say is that access information and credible information from your local sources. So you're in member states, you have ministries of health, they will have information up. If you don't see the type of information you're expecting, you can engage and you can ask, you can call, you can find out, and you can be the stimulus to get there. You can say, well, look, I'm interested. This is a relevant topic. I went to a webinar the other day and I have a lot of questions now. And the presenter on the webinar said I can come to you, right? So you can be the stimulus if you're not seeing the information that you need to see. But I'm sure there's information out there. I've seen information. So I would say access from credible sources locally. Now, regionally, The Caribbean Public Health Agency has its website, and we continue, and we have social media pages with campaigns that we roll out. So continue to tune into those. Also, there are other public health agencies that operate in the same space, and you can continue to follow those. For example, the Pan American Health Organization, etc., and you can follow for where information is out there. And importantly as well, we're at a webinar that is being organized by the CARICOM Secretariat, right? So you can access the websites, you can look out. This is a relevant topic, and there's no better time to speak about it. And I believe that even though it is evolving and not all the questions are answered, and that's why there's a key role for research, the basic guidelines are there that you can use in order to protect yourself and your family.
Thank you so much, Dr. Cox. If there's anybody who's on Zoom now and would like to share a question, you can feel free to drop it in the chat. I have another question, just to recap for those who might have joined us a little bit later. Persons inquiring, what are the symptoms and signs that they should be looking out for, as well as how exactly is it transmitted? So you would have indicated a possible respiratory component, the fact that mask wearing can be protective. What are some other means of transmission, and what are the symptoms we should be looking out for?
Correct. Good question. We had a few slides on what one should be looking out for when we were speaking about the suspected case, etc., and looking at the case definitions. We didn't delve into it, but knowing that the recording is going to be accessible, wanted to show it so that persons can go back and refer to it. But just of note, I just want to say that the main means of transmission is sexual, right? So that persons are familiar. Yes, there's a respiratory component from what we've been seeing, etc., but we need to understand that the main means of transmission is sexual. And as I shared with the statistics, we've been seeing 99% of the cases over the past 6 months in males, right? And 96% of those in men who have sex with men. Importantly, we don't want to say, well, I just let's assume you have a female. The female might say, well, 99% males. No, then I don't have a problem. MPox will not affect me. We don't want to say that. That is the wrong message. It leads one to fall into a false sense of security. And that is not what we're conveying. We're just identifying, based on the data that's coming in, which are the main at-risk groups. But of course, as I mentioned, for several reasons, because there are different ways of transmission. We spoke about coming into contact with contaminated materials, etc. So we need to ensure that we do what we need to do on an individual level, factoring in all the things that would have been shared to ensure that we protect ourselves.
Thank you so much, Dr. Cox. And just a reminder to those who are joining us, there are various reliable sources for information on MPox. Dr. Cox would have referenced the CARICOM website, the PAHO website. There are various social media platforms to include Instagram, Twitter, etc., where regular information is shared. So feel free to follow those pages, turn on the notifications as well, so that you can be updated as soon as content is shared. For those on Zoom, if you'd like to, you can unmute your mic and indicate if you have a question. But as we wrap up this very informative session, just to recap some key points, one of the things I wanted to highlight from your talk, Dr. Cox, was the fact that physical activity is a good way to stem or prevent some of these conditions. We know that non-communicable diseases are on the rise and prevalent in our region. And so having well-controlled diseases or well-controlled illnesses is a good way to prevent or reduce our vulnerability against MPox. We spoke a little bit about the mental health component and the importance of working together to reduce depression, reduce anxiety surrounding these outbreaks. And so that was a very important point as well. So as we wrap up, I know our audience has been sharing their questions, and we say thank you to those who have been following us on various media platforms. We will still be taking questions if you have any in the chat, and we'll be able to follow up with you at a later time. But just a final thanks to Dr. Cox, who was a facilitator, and colleagues for this eye-opening discussion. A reminder that the PAHO website has many resources on MPox, including the impact of outbreaks on individuals with chronic illnesses. I'm going to invite those who have joined us to complete our final quiz. Yes, we have another four question quiz as we close, and this will allow us to determine what you've learned and some key takeaways. So take a look at the chat for the link and complete the quiz. We'll give you a minute or two to do that. While you complete this quiz, I'm going to invite a representative from the Directorate of Human and Social Development to share some words of appreciation. So handing over to them.
Hello, Ms. Karen, can you hear me? Sorry.
Yes, hi. Yes, we can hear Dr. Cox.
My apologies. The connection just dropped, but but it's good to be back. But it's the age that we live in, right? Everything is technology, but at times we have technological difficulties.
Yes.
But I'm happy to be back. So if you have more questions, please.
Yes. So we are at the stage of the post test. You
Okay.
share the link in the chat for those who are going to complete it. And we're offering final thanks. We have a representative from the Human and Social Development Directorate who will be coming on next to share some words of thanks and appreciation. So you can hold on for that.
Okay, thank you. Just for me to say that it's been a pleasure, and I would like to commend the CARICOM Secretariat for an excellent initiative, and I would like to encourage that this be continued, that we can look at other relevant public health issues for the benefit of all. Thank you so much.
Thank you very much, Dr. Cox.
Okay, good morning all. I know we're wrapping up. I don't know if you can see me. So hello, good morning all. My name is Serena Bender-Pelswick. I work with the Health Sector Development Desk here at the CARICOM Secretariat, and I just wanted to express appreciation to the persons who are here today on this webinar. So today's event was again in observance of Caribbean Wellness Day. And this really would not be possible without the hard work of some of the technical and creative support persons who would have contributed to this exercise. So on behalf of Ms. Alison Drayton, our Assistant Secretary General for the Health and Social Development Directorate, I do want to extend gratitude to first Dr. Lisa Indard at Interim Director of CARFA, and of course our outstanding panelist and expert, Dr. Horace Cox, who are from the CARFA team and really lent the support this morning on the technical aspect of the information provided to you on MPox today. Apart from that, I do want to extend a sincere appreciation to our outstanding host and moderator, Dr. Tiffany Sigaret, who has really led the conversation and guided the entire exercise this morning beautifully. And also to our team from the Human and Social Development Directorate, as well as our communications team here at the Secretariat, including Ms. Tamara Bob, our Program Manager for Health Sector Development, as well as our Program Manager for Communications, Mr. D.K. Noel, Timothy Austin, who is the lead on this particular exercise and also supported the hosting, as well as Ms. Chanel Spooner, all who support the communication, both on CARICOM platform, as well as our wider social media platforms. We also want to extend a special thanks to the audience today who spent their time with us this morning to go through this entirely important exercise. Again, giving us your precious time and really having questions that provoke thought throughout the entire exercise. So with that, we extend sincere appreciation to you for joining us this morning, and we hope that the information was useful to you and can be used in your daily life. So, ladies and gentlemen, thank you so much for your participation today, and please continue to engage with CARICOM Secretariat through our website and social media platforms for news on our upcoming webinars and virtual events, and of course, any other announcements that will be related to MPox. Enjoy the day. Thank you.
Thank you so much, Serena. We appreciate your appreciation. Thank you to the Director of Human and Social Development. On behalf of the CARICOM Secretariat and CARFA, I would like to thank all of our participants who joined us today. As a reminder, the webinar was recorded and will be posted on the CARICOM website, the CARICOM YouTube channel, and links will be posted on various social media platforms. Please do join us at our next webinar. You will receive the announcement via email and our social media platforms. Finally, we encourage you to continue to stay engaged with CARICOM. Visit our website, caricom.org, and follow us on social media, Facebook, Twitter, Instagram, and LinkedIn at CARICOM.org. Thank you, everyone. It's been a pleasure being your host. Until next time, I'm Dr. Tiffany Skerritt Fleming, signing off.
Bye, Tiffany, and thank you. Bye, everyone.
Bye, Tim.
Bye, everyone. Good afternoon.
Goodbye. Goodbye. Take care.